Lovely to see this morning, Health Secretary. Let's start with events overnight in Israel. How worried should GB viewers and listeners be about this escalation in the Middle East?
Well, this was a significant attack by Iran on Israel, and of course our thoughts are with everyone who have been affected by these attacks. And let us not forget, this wasn't just drones, this was also apparently missiles being fired over the region into Israel. Now, I hope your viewers will understand this is a very fast-moving military situation, and so I'm limited in what I can tell people and how I can update people. But what we do know is that the Prime Minister, the Foreign Secretary and others are working with our international partners to try and de-escalate tension in the area and to support Israel in this difficult time, but also to ensure that we do not see further attacks by Iran. We do not see this, because none of us want to see the humanitarian impacts that this is having in the region.
I appreciate your words there about de-escalating the current tensions. However, I'm assuming that Britain will step up its military support to Israel should the time come to do that.
So you've just stopped, my sound's just stopped, but I'm going to answer anyway, because I know that your brilliant sound people will be able to get the sound back to me. I think you were asking me about the United Kingdom standing with Israel, and you are right. Of course, we as a free democracy want to stand with the people of Israel. Israel is the only democracy in the region. It had that terrible, terrible attack in October, and we remind ourselves that there are still hostages that are held captive by Hamas, and of course we want those hostages to be freed. We also want a humanitarian pause so that we can get aid into the affected area. That is a really important point. But we will be working across our free democracies across the world to ensure that we stand with Israel, but we do so to try and de-escalate the tensions in the region, because nobody wants to see an escalation in the sorts of military activities that we have seen in the last 12 hours.
Let's just talk for the remaining time about the Cass report. I suppose a simple question. You've been quite your rhetoric on this has been really strong. You've said that the NHS must reveal the fate of 9,000 transgender young people treated by the Tavistock Clinic. Obviously, this report suggesting that children have been given puberty blockers and cross-sex hormones, despite, as Hilary Cass has said, remarkably weak evidence, that does vindicate. J.K. Rowling, feminists, people like me have been writing about this for years. I suppose the question that remains for the government is, if you were going to go out tomorrow as a child and want to be prescribed puberty blockers, you still could, right?
Well, first of all, may I start by thanking you, Camilla, and the many, many other people who have battled against this culture of secrecy and intimidation and ideology over recent years. People have dared to ask questions, perfectly reasonable questions about the form of some of these treatment pathways, whether they're the right thing in the best interests of children, and they have then been shut up by people who focus only on the ideology rather than on the very, very complex needs of many of these children and young people. And if I may, I'll take just a moment to reiterate my disappointment that the Labour Party has been part of that culture of secrecy and intimidation and ideology. We have been told
this madness
by my
unfolded under the Tories'
that we should
watch.
get over it.
This madness has unfolded under the Tories' watch. We've had a situation where teachers, even now, are disregarding the guidance that you've issued. So the argument for the government, I think, is you're going to have to legislate, because we've got stories of a Brighton GP at a private clinic giving out puberty blockers to children after 10-minute consultations. The report is welcome, the trans guidance is welcome, but not if it isn't legally binding. Otherwise, these ideological zealots can just continue with this. So my question to you as Health Secretary is, when will puberty blockers be banned for under 18s? When will that happen?
So the NHS has issued immediate guidance that puberty blockers will not be prescribed routinely on the NHS. The reason that word routinely is in there is because clearly if there are young people who are currently on those medications, those drugs, then there has to be a clinical pathway to taking them off those drugs because they are so very strong. We need to ensure that the physical and the mental impact of taking, of removing them onto other pathways is in the best clinical needs of those children and young people.
But
what we want to do is to stop children and young people. So what we want also to do is to stop.
But let me just make this point about banning. But the banning thing, I raise this because obviously we've got this tobacco legislation that's been proposed.
Yeah.
You're wanting to ban tobacco sales to the under 15s. You're talking about Churchill. Obviously, Boris Johnson made this point about Churchill would never have banned cigars. You say that maybe he would have. So we're happy to ban tobacco products,
say that.
but we're not happy to legislate against puberty blockers for the under 18s, even in the face of this overwhelming evidence.
So, Camilla, let me take it step by step, and I'm sorry, this is quite complicated, so forgive me if my answers aren't like one word long, because actually I think this is complex and deserves a bit of detail.
Okay.
So in relation to puberty blockers, private clinics and international prescriptions, because all of these things have been raised over recent days, understandably so, I am working at pace with my officials to see what we need to do to block off these avenues of prescription, because given the devastating report by Dr. Cass as to the, her words, shaky foundations of the evidence for these drugs being prescribed for children and young people suffering from gender dysphoria, we need to ensure that that cannot and will not happen in future. Now, the wider question about guidance, in fact, is something that my Cabinet colleague, Kemi Badenoch, has talked about today with her role as Minister for Equalities. We need to tackle this ideology that exists in some parts of the public sector that somehow government guidance is there and they don't need to follow it. This report is so clear, so thoughtful, so thorough that we expect now all clinicians, whether they are NHS or otherwise, all clinicians to abide by the Cass review findings. CQC, we have been in contact with this week, and my officials are meeting them again on Monday. They are the body that are responsible for licensing practices to prescribe. It's a highly regulated activity, and CQC have confirmed that the one gender clinic, private gender clinic, that is licensed to look after children and young people with gender dysphoria has no license whatsoever to prescribe these drugs to children and young people under the age of 16.
Okay. I
want us to go further because I'm very worried about that group of young people from 16 to 25 as set out in Dr. Cass's report. But these are, these are many years of ideology that we are now combating. We're having to, really deal with on the evidence, but we must also do this in a caring and compassionate way, because at the centre of all this are children, young people with complex needs and their families, and we want to support them whilst, of course, we're ensuring that the guidance and the structures around them are really important. Now, let me come on to smoking, if I may, because that's a fair challenge.
Very briefly, because I feel we're running out of time.
All right. Okay, so we all know the evidence with smoking. It causes 1 in 4 cancer deaths, kills 80,000 people a year. But pretty much every single minute of every single day, someone is admitted to hospital with a smoking-related condition. I don't know any smoker, adult smoker, who's pleased that they took it up. And we know that most smokers start before the age of 20. So we are not, absolutely not, stopping the ability of adults today watching this programme who smoke cigarettes or tobacco. We are not stopping them from being able to carry on buying their cigarettes, their tobacco. What we are doing is saying that from 2027, anyone who turns 18 will not be able to buy cigarettes legally in shops, because the impact for them as individuals, but also for people living around them, we all know the dangers of secondary smoke, and indeed the impacts on the NHS are so significant that we think this is we think that there is a real time now for this culture change. And what is more, we know that the public public agree with us, because in recent surveys, some 71% of people welcome this change. So this isn't about affecting adults. This is about helping protect our children from the awful, awful addiction of nicotine, because there is nothing freeing about an addiction to nicotine.
I know, but
and
then
that's very much where I come from.
You've written in the Telegraph today that you think Churchill would support this ban. I just remind you of another of his quotes.
No, I haven't.
If you destroy a free market, then you create a black market. That's a Churchill quote, Miss Atkins.
So in fairness, the copywriters of the Telegraph have had some fun with the headline. What I've said is that I quoted Winston on a point about fact and reality.
Okay.
And the facts and the reality I've already set out. In relation to the black market, though, that's a really important point. I used to prosecute criminal gangs that would bring counterfeit cigarettes in. It's why we're investing, as part of this package, £30 million to ensure that Border Force, HMRC and other law enforcement agencies can tackle the illegal market.
Okay.
And by the way, when we raised the age of smoking from 16 to 18 before, we saw the prevalence of smoking in that group of people fall by 30%.
Okay.
So we think this is actually very much in line with what we've already done as a society to try and help people off cigarettes and not being hurt by the tobacco, by the tobacco and the nicotine that we know are in those tobacco products.
Health Secretary Victoria Atkins, thank you very much indeed for joining this morning and bearing with us through that sound problem.